Welcome. It is that time, Friday afternoon. It is Ask Dr. Geier Live. Wherever you're watching, hope you're making today your masterpiece. This is a fairly quick show for you. If you have orthopedic questions, if you have injury, surgery, rehab questions, this is your time to ask. This is the only time each week I do it. I don't do it anywhere else. Email, comments to videos, anything like this, but this is your chance to ask your questions. So leave those in the chat, not in the comments below on YouTube. All I can see is the chat, so put them there. I'd love it if you'd put your name and where you're located. Very excited to be here with you. I will stay as long as there's questions. So it may be a 30-minute show, it may be a 5-minute show, but very excited. Also remember, this is not medical advice in any way, shape, or form. I haven't seen you, examined you, looked at x-rays, looked at MRIs, lab work, anything like that. So this is meant just for general information and educational purposes only. But hopefully you can understand that injury a little bit better so that you could talk to your doctor, your orthopedic surgeon, and say, hey, what about this idea, for what that's worth. Also, if you want to talk health and wellness, I am certainly more than happy to do that and talk about regenerative medicine, anti-aging medicine, but most of what I expect you'll have would be injury-related questions, for what that's worth. Georgia, it's good to see you as always. I appreciate you being here. CD Harpale, I don't know. I am good. I have leg surgery where they inserted a rod in my leg 3 months ago. When I woke in the morning, my leg feels weak, and I had too much limping. Yeah, it's hard to know necessarily 3 months out if there's anything necessarily bad that suggests. Obviously, by 3 months, hopefully that rod in the center of the tibia is starting to heal it. It may not be completely healed, but it should be getting pretty darn close. Somewhere by 3 to 4 months, that should be completely healed, in which case you should not really have any discomfort walking on it at that point. But, it could be... I don't have a great answer, whether it was overuse the day before, so that the muscles are weak and more stress is going on the bone. It could be any number of things. That wouldn't necessarily worry me. Where I'd get kind of worried is if I was having a lot of discomfort at the fracture site, where the fracture site was, as I'm trying to walk, and it persists. It's not just a one-time thing. If it's more than a few days, I might call up the orthopedic surgeon and say, hey, I'm having this problem. He or she would probably bring you into the office, repeat x-rays, and just see if anything is going on. All right, you are more than welcome. I am happy to do this. Lydia, 37-year-old, let's see, there must be another, there it is, another comment. Twisted my right knee in March getting out of a chair, got a locked knee, was not able to straighten it for 2 days. All right, that's kind of interesting. Well, shoot, I saw your comment. I was going to tell you I knew what that injury was. That was going to be a meniscus tear. Sure enough, a chronic displaced bucket handle tear in the meniscus. Lydia says, let me get that off the screen. Is there urgency for the surgery? I'm not sure when I could have gotten this. I plan to do the surgery in November. Okay, here is my thought. And again, this is not medical advice, but this is my thought. There's a lot to unpack here. First of all, I should have had this ready. I apologize. This is my knee model. This is the meniscus. You have one on the medial side of the knee. You can see lateral side of the fibula, medial side. Here, this is the lateral meniscus out on the outside. Bucket handle meniscus tear means, and I can't really show you on this because I don't want to tear it up, but you have an inner rim. Bucket handle means just that. If you imagine a bucket, like it's holding a bucket of water, the handle flips back and forth, right? Well, what happens here is you get a tear that goes all the way around the inside of the meniscus, and the inner part flips into the center of your knee where your ACL and PCL are, and then it stops your knee from being able to fully extend your knee or fully bend your knee. It's locked. It's stuck in a certain position, just like Lydia said. Usually, once it's locked, that is not something that unlocks on its own. You have to go in surgically and unlock it, with the scope, and you use a probe to sort of push it back in place, and while you're there, you go ahead and repair it. That is one of the good things about a bucket handle meniscus tear is those are almost by definition repairable, meaning you can sew them together with stitches, in which case if it heals, and again it's not a perfect healing rate, there's somewhere between a 15 and 40% chance even with surgery it doesn't heal, but it's still better, it's still worth trying because you potentially save that entire meniscus as opposed to trimming it out. And a bucket handle tear usually is a large percentage of the meniscus. So if you just trim it out, you're going to develop arthritis very quickly within a few years usually. There's a lot of stress that goes through the lateral part of the knee, much more so than the medial side. And so you want to have all the meniscus you can. The problem by waiting, and again, not medical advice, Lydia, but if you give a bucket handle meniscus tear much time where you're physically active and you're sort of pounding on it, it may become unrepairable. It may detach at one end or may get kind of beaten up and frayed and it becomes not repairable, in which case then again you're taking that entire piece out, increasing your chance for arthritis. So those are the two reasons typically that not only do we do surgery, we do early surgery for that. One, because usually the knee's locked and you can't get motion back without going in and putting the bucket handle part back in place. And then two, you want to give yourself the best chance possible to maintain that entire meniscus for what that's worth. All right. I don't know the name, but 18HC United, I am happy to help. Let's see. MRI, left knee, sprain, partial tear of the ligament on the inside of your knee, sprain of the ACL, cartilage bruise, small amount of fluid. You just basically copied your MRI report in there. It's hard for me to say without seeing it and without being able to examine you. Typically, ACL injuries, despite what an MRI report shows, they are all or none phenomenon. You may have a partial tear, but if a large portion of it is torn and only a small part is left, which is usually what happens in a partial ACL tear, that knee is still not stable. Now, I'm not sure if what you're saying, a ligament inside your knee, if you're talking about the ACL or if you're talking about the MCL. The MCL, so the ACL is that big, thick ligament in the center of your knee. The MCL, big, thick ligament on the side closest to the midline of your body, that does typically heal on its own. So what you would want to know is actually how stable is the knee with the ACL and MCL, presumably, and not just seeing the MRI, which obviously I can't do, but examining your knee, examining the patient's knee and seeing if the ACL is unstable. Lockman's test, but more importantly, what's called a pivot shift test to see if that knee buckles or reduces as you put it back into full extension. And then with the MCL, how much it opens as you stress the inside of the knee. So it's really kind of hard to say surgery or not. All right. Chitra, I apologize if I'm saying that wrong. Oh, you're so welcome. Whether inserting rod in leg, will it create any kind of problem in the future? We'll be able to run and jump. That's a terrific question. So generally, yes, there's no restrictions. Paul George, an NBA player, all-star player for the Los Angeles Clippers, when he was playing for USA Basketball, broke his leg. They put a rod down the center of his tibia. He's back to playing at an all-star level. I mean, he was out a little bit this year with an elbow injury, but yes, you can get back to play sports. The last one of those surgeries I did was on a high school pole vaulter and did the tibial nail that night. And yeah, he finished the season. I think I don't think he had much time left, but he was able to run and everything after that. It takes a little bit, no question. Can take 6 to 9 months sometimes, but absolutely the goal is to get back to full activity for sure. I don't know your name, Baby Doodles, but hello. May 30th, been doing 70%. Haven't played soccer since last year. So, yeah, I mean, that is obviously the goal with all of this is to get back to sports. All right. Catherine, or Kitty in Maryland, fell down the stairs 5 years ago, strained muscles and ligaments, could only shuffle with a walker, now still having sharp pains. It's hard for me to give you too much insight without knowing where those injuries are, what part of the body those muscles and ligaments are. That is a little interesting that 5 years later, still having trouble walking. So I'm happy to give you thoughts. It's hard to know without knowing where that injury is. Mary, I apologize. I don't see your question, but Mary is in California. Oh, there it is. I'm sorry about that. Basal joint arthritis of the left hand. Cortisone shots, when it becomes painful, need to have surgery. I'm using a cane to walk. The shots have helped. Yeah, the problem so basal joint arthritis is, I don't know where I can show you this, but I'm trying to figure out where to put this on the camera, is kind of right in here. There's a joint, the carpometacarpal joint of the thumb, and that it just gets arthritic. And cortisone, yes, will make it feel better temporarily, but it doesn't do anything for the breakdown of the cartilage. I've used PRP. Exosomes are another good option to try to prevent surgery, not usually paid for by insurance because the FDA still calls PRP and exosomes and stem cells and things like that experimental, but it is something to potentially think about. Hand therapy typically might get you a little more range of motion, but doesn't typically alleviate pain. That is something that surgery can be helpful. A lot of times what they'll do is they'll take a tendon, the hand surgeons will take a tendon from your wrist and use the tendon, sort of roll it up and use it as a spacer. They take out the arthritic small little bone and use that tendon as a spacer. Outpatient surgery, it does well, but it is a surprisingly long rehab. Good success rates, but depending on what you do activity-wise, work-wise, things like that, can be 3 or 4 months, sometimes even longer before you really get back to normal. I hope that answers your question. All right, I forgot your injury. Oh, the rod in the leg. I apologize. 3 months after surgery, PT sessions. When you're going to be able to walk normally is typically when it heals and when you can sit crisscross on the floor. You can do that whenever. The only reason the knees hurt at all typically is that usually you put the nail in, the incision is right in the front of your knee. So sometimes people do get pain in the front of the knee, but there's no reason you can't sit with your knees crossed and flexed from the very beginning. As far as when people can walk normally, it's really just a matter of when that has healed. Usually it becomes pain-free. So I usually tell people that it kind of looks normal walk-wise 3 or 4 months when it's fully healed 3 or 4 months later. But some people walk normally before that. All right, Lydia, after meniscus repair, if it does not heal back, then if it doesn't heal, you would typically have to go in for a second surgery and trim that part of it out. Because if it doesn't heal, then it's going to start catching again. It'll get loose and start catching. Now, it may not break free. It may just cause pain. But yeah, typically it's a second surgery to trim part of it out. That's why one of the things that some surgeons try when they do those meniscus repair surgeries where they put stitches in it to get it to heal. One of the reasons there is a failure rate of that surgery, I should explain that. The meniscus has really poor blood supply. That's one of the reasons, at least in people 40 and under, you almost always need surgery for a meniscus tear, whether it's a repair or just trimming it out, depending on the nature of the tear, but it has terrible blood supply. So even a repair has better odds than other types to heal with surgery, but still may not because there's not that much of a blood supply. So some surgeons will do procedures like platelet-rich plasma in addition to the surgery to try to increase the healing rate. So that's something else to think about. Georgia says, no, I'm perfectly fine talking about this. Collagen supplements. I was just talking to a patient about this yesterday, actually, about collagen supplements. I am a big fan. I just had another cup of coffee a little while ago. I've had probably more than I should for any one day. But in the last one, I put coffee. I am not saying this product to endorse it. I'm not paid by them or anything. That's just what I have. I have Bulletproof coffee, and I use that. It's grass-fed. I think it's really clean. There's one that I really like that our practice sells. I think it's back ordered now. There's only one company in America that sells it called Collagen, with the gen, all capitals, capital Gen. It has a type of collagen called Fortigel. It was created in Australia, I'm pretty sure. And that's got the best data as far as arthritis and joint pain, potentially healing tendons and ligaments, even though in theory they all are beneficial for bones, joints, tendons, ligaments, muscle, things like that. But not just orthopedic indications. Skin, that's probably the big one, but there's a lot of good uses for collagen. It's a good source of protein. I do think that potentially grass-fed would be important, and one that doesn't have a lot of fillers and contaminants, so that might be my only thought. But I am a big fan of collagen. You can put it in your coffee, you can put it in a protein shake. Big fan of that. It's funny, somebody asked me about this another show not too long ago. Can you remove the rod any point in time? You can, but that is a monster surgery to take that out. You can take the screws that lock it in place out relatively easily, but actually getting it out of the knee, especially once it heals, is a nightmare. Typically, at least here in the United States, we only take those out if they get infected or if it didn't heal despite the surgery. And even that is a monster surgery, just taking it out, but then you'd put another one back in. So I can't tell you that I've ever taken one out, and I don't do really trauma orthopedic surgery anymore, but I did it at the second busiest trauma hospital in the country when I was a resident, and then for 8 years. And at the beginning of my career, I took call at a level 1 trauma center, tons and tons of femoral and tibial nails. I can't tell you that I ever took a tibial nail out for just people wanting it out. We took this locking screws out sometimes because they were irritating people, but the tibial nails I had to take out either due to infection or due to they just didn't heal. The patient was a smoker, or patient had a big open wound that just caused it to not get healed, and that was sometimes why they'd get infected. And I didn't have to do that very often, 2-3 times ever. But it was a monster, like maybe not 4 hours, but 2.5 hours. You lose a lot of bone taking it out. It's a big deal. So I would strongly, if it was me, I would just leave it in, quite honestly about that. You are so welcome, Georgia. I love talking. I do this because I feel like this is my one chance to kind of help a lot of people. I get hundreds of comments to my YouTube videos every week, and they're all, hey, I have that injury. This is what happened to me. Blah, blah. They tell me the story, and then what would you do? And I just can't respond to all those. So this is my answer to that. Is just once a week I'll get on here and answer any questions people have. But I love talking about health, wellness, exercise, nutrition. You attend some of my Better Than Ever live shows. I can answer questions about any of that kind of stuff. Collagen and proteins and diet, Mediterranean diet and ketogenic diet and peptides and exosomes and all kinds of cool stuff. So I am happy to answer those on this show. It's just that's not what I typically get here. Al Mirzan, hi. Please feel free to share your question. Had an accident 2 years ago, surgery for a tibial plateau fracture. I am really glad that my videos have been helpful. That's a tough injury too. That if it lines up well with surgery, everything's perfect. It can lower your risk of arthritis, but because that fracture, those of you that don't know what a tibial plateau is, that is the top of the shin bone right below the knee, and the fracture extends up into the joint, and so there's a high rate of arthritis afterwards. It's lower with surgery, but not as low as not having the injury. But it's a long recovery, typically 3-4 months minimum. Good for you for getting through that. Grade 2, grade 3 MCL injury gradually heal by its own. It depends. Yes, usually it would. Grade 2 especially. What that means, layman's terms, grade 1 is sort of a small partial tear. Grade 2, bigger tear. Grade 3, complete tear. If it's off even a complete tear, grade 3, off the femur side or in the middle, yes, that's probably going to heal on its own with a brace that allows you to bend your knee, but it prevents side-to-side motion. The ones that sometimes don't heal are ones down here on the tibial side, the tibial insertion, because just lower rates of healing. But a lot of times what happens, it pulls off and then it flips outside. What you don't see on this model are the hamstrings. The hamstrings are in the back of your thigh, but some of the tendons attach right over that, and then the MCL flips out when it tears, and so it's outside of it, and then there's no way it can heal, so then you have to go in surgically and fix it. That is certainly not the common thing to happen by any means. So those are the rare times that you need surgery, or you would do it in a case where it just didn't heal. Or I guess the other one would be, and this is not what you're talking about, but a multi-ligamentous injury. So combination ACL, PCL, MCL, that type of thing, you would go in and repair the MCL. All right, Mary. There are other things. I'm a little outside of the hand surgery world, quite honestly, Mary. The tendon is what is that called? LRTI is the name of that surgery. It's been around forever, and that's, I think, still the most common thing. There are implants that can be used. I know when I was a resident way back in the day, the training program where I trained, they had an implant that they developed for that surgery. I don't, to be fair, know all the different options at this point. I have never been a hand surgeon, so I see athletes with hand injuries, especially when I'm covering games and teams, but then you send them to the hand surgeons for it to be done. There are options. I just can't tell you that I think the tendon thing, I think, is the most common one. Oh, I appreciate it. I have never heard that my videos are motivating, but that makes me happy. I appreciate that. Again, I don't know. I can't examine you to know if your MCL is just going to heal with therapy. Usually, yes, they would heal on their own. Catherine fell down the stairs. Injury was in your groin pubic area, still having sharp pain. So what I'd be curious to know, and some of it depends a little bit on age, not as a... I just say that because injuries typically follow certain age patterns. But when you're talking pubic groin pain after a fall, and you're talking about people 40 and older, typically you're going to be talking about a pubic fracture, pubic ramus fracture. Where is my pelvic model? Not usually talking about pelvic injuries, but usually a fracture of this ring here, sometimes in both places. Now that should heal certainly in 5 years. Those actually heal very well. So I don't know necessarily why somebody would still have pain. Here's the other thing though. Groin pain is where your groin is where hip osteoarthritis is felt. People sometimes think when they think hip, they think the side of their hip, they think their buttock, but actual hip joint pain, ball and socket joint pain, there the ligaments are covering the ball and socket. You're going to feel that in your groin more than anything. So that's the other thing to think about. A set of x-rays, probably like a AP pelvis and a lateral of that hip, probably helpful to have a good sense of what is going on. Almerzon, we're going to have 2 bucket handle tears of the meniscus today. That is crazy. Surgery's done, 5 months, exercise, walking normally. When can you run? Again, not medical advice. I'm not your doctor, so I am not telling you you can or cannot run. Your doctor needs to tell you that because he or she can examine you and see your motion and all that. Typically, I say somewhere between 3 and 6 months when you know that meniscus is healed. And it's hard to know, but typically it's things like no pain with walking, no pain with full flexion or full bending of the knee, that kind of thing. Before 3 months, I'm pretty confident it hasn't completely healed. But once you get 3, 4, 5, 6 months, it starts to potentially be okay. But it depends, and you got to have full strength of the muscles around it to protect it, things like that. Not medical advice, just something maybe to talk to your doctor about. Football would be typically longer. Typically, when you're talking about cutting, pivoting motions, you're talking 6 to 9 months. In the U.S., those surgeries, meniscus repairs for high-level athletes are usually more like 9 to 12 months. And then CD, our last question of the day, does rod insertion of the leg make it more sensitive in wintry or snowy days? That's an interesting question, and I have not seen that very often, but I've seen it with implants, really with lots of different types of surgeries. Just the rare patients say they can tell when it's cold. They can tell when it's going to rain. That's a real phenomenon. Enough patients say that I know it's true, but I don't know that we have a great sense of why certain people get that. So yes, you might. I wouldn't worry about that. I wouldn't certainly take the rod out in case you're worried about that, but you might. It is kind of a weird phenomenon. The one that I would probably see the most often were knee replacement patients. The maybe 20%, 10% of them, I don't know, would say that they could know that it was about to rain. And I don't know if that was a barometric pressure drop or what, but I always thought it was interesting. You are welcome, and I plan to have a great weekend. I hope you do too. Thanks everybody for joining me. Remember, if you have an injury and you want to see somebody, an orthopedic surgeon that talks about more than just surgery and physical therapy and cortisone shots, the link to my website is in the description below. I see patients in Charleston, South Carolina, and if you live in North Carolina, I could see you in Charlotte, where we have an office. Typically, people from out of town come to Charleston, so that's what you do. I will be back here again next Friday. Georgia, you have a great weekend. And I don't know that name, Moonstar. Maybe reading that wrong. I hope you have a great weekend too. Have a fantastic week. I look forward to seeing you right back here at 12 p.m. Eastern Time. And if you know people that have orthopedic injuries and are struggling to know what to do with it, tell them about this show every Friday, 12 p.m. Eastern Time. Have a fantastic weekend. I'll talk to you soon.